Thanks for making dinner, dear. How was your day? Did you hit the gym today?
Yes, honey. Today was pretty good. I was a little slow at the gym, but I am getting consistent these days. I met our neighbor, Mike, during our group workout session. Turns out, he got diagnosed with diabetes last month and is starting to go to the gym. He was asking for advice about his diabetes, and since he knows you're a doctor, wanted to know more about it.
Of course! I can help out. I can give you some basics of what diabetes is and how to manage blood sugar levels.
Yes, that sounds good.
Well, diabetes is a disease where your body has high glucose levels. The defect either lies in the pancreas, which is your insulin factory, or in the body when it cannot use insulin as it should. Commonly, I see two types of diabetes in the clinic. With type 1 diabetes, the body does not produce insulin at all. It is mostly diagnosed when you are a child or still young. In type 2 diabetes, your body does not use insulin properly. Mike likely has type 2 diabetes.
This is quite eye-opening. Do carry on, George.
Most of the symptoms in diabetes comes from high blood sugar levels. My patients complain of excessive thirst, fatigue, and unintended weight loss. One time, I was struggling to treat a patient's skin infection, and they were just not getting better, even after a few rounds of antibiotics. We then realized with a blood test that they had diabetes. Actually, Jenny, many people with type 2 diabetes show no symptoms at all. We usually find out someone has diabetes during annual checkups. That's why annual checkups are so important.
I am learning so much already. How do we treat diabetes then?
It depends upon the type of diabetes, really. In type 1 diabetes, you have to take insulin since oral medications do not work. Whereas in type 2 diabetes, I like to tell patients to start with lifestyle changes. That is very important, you know. I talk to people about going on diabetic diets and the importance of exercise to control diabetes, which means Mike is on the right track. There are also varieties of oral medications on the market for diabetes. I prescribe medications depending on if my patients have hypertension, heart failure, or any kidney failure. It really depends on what works best for each patient.
So, Mike's diabetes pills or your patient's diabetes regimen might not be the same. The idea of insulin really freaks me out. Is insulin required to control blood sugar in type 2 diabetes?
Oh, Jenny, there's no need to be scared of insulin. If diabetes is not controlled with diet, exercise, and pills, insulin helps a lot. I ask people to check their blood sugar at home and take a blood test called HbA1c, which is helpful to decide if I need to prescribe insulin. I will tell you more on the HbA1c test tomorrow. What do you say?
Sure, let's continue tomorrow.
Alright, for now, I hope you clean up the kitchen. We will be back with more from our family to yours.
Please like, share, and subscribe to our channel.